nhớ đài cái máy luôn đó chị. Em thấy tắt ban đầu rồi em phải lý thường right.
All right. So this is the week 11 of our medical speaking class, and we'll go ahead. Okay, I'd like to remind you that you need to speak a little bit louder from my end. Okay, you ready?
Yes.
Okay, go ahead.
And my choice is dysentery.
Okay. What is the topic?
Yeah.
What is the topic? What is the diagnosis?
My topic is dysentery.
Dysentery. Okay, go ahead.
Hello, Mr. Win. I'm Dr. Nhi. I'm gastrointestinal. I'm working as gastrointestinal department. Today I'm your doctor of your son. And what can I do for your son?
Oh, I don't know. It sounds like my son's not doing well. I'm not sure what's going on. Can you tell me what's wrong with my son?
So what's wrong with him?
Yes.
So what's wrong with him?
Well, you will tell me. You explain to me what happened to my son.
Your son passed watery stool many times in a day, and he cries a lot. He doesn't look good, and he gets fever and vomits 2 or 3 times a day, and it lasts in 2 days ago, right?
Yes. Now, is it normal? Because I know that my son's he has to, when he was born, he has a couple of diarrhea in the past. Now he has such more diarrhea. Is it normal or it's not normal?
Oh, I see the blood in his stool. And yes, and he gets fever, high fever with high temperature. And after examination, I think he gets dysentery. Have you ever heard this disease before?
No. Can you tell me more about that?
Yes. The dysentery is a quite common disease in children in tropical countries, and this is caused by bacteria, maybe from food or from the air. So your baby may be infected by this kind of this bacteria.
Well, is it serious?
It's make children pass watery stool. Yes, and the complication, the most severe complication is that children will have a dehydration.
Really?
Yes.
Wow. It sounds scary now. Now, is that contagious? Can my wife have that too? Do I have that?
Oh, sorry, I don't catch your idea.
Is that contagious?
Oh, yes. It is contagious. It can spread to other babies or even adults through the fluid or through the maybe the droplets, no, through the stool.
Wow.
Yes.
So I have diarrhea. Do I have that too?
Yeah.
I have diarrhea now. Should I see a doctor?
Yes. I mean that your baby can spread the bacteria to other people through the stool.
Wow. Okay.
Yes. So
what's the treatment? How would you fix my baby?
Yes. all of the diarrhea with blood in the stool need use antibiotics. Antibiotics will kill the bacteria to treat your son. So we need to use antibiotics to treat this disease.
Wow.
And this kind of do you know? Do you want to know this name of this antibiotic?
Yes, please. I like to look up on the Google. What's the name?
Oh, its name is ciprofloxacin.
Is it? Now I heard that it is a very strong antibiotic. Is that safe for children?
It is used mostly in some common infection in children, especially disease from digestive system.
Wow.
Yeah. Sometimes it's used for urinary system.
What are some side effects that I should look for? So what happened to my kids?
Oh, your kid is 2 years old, and with this age, I think I know that we don't have many side effects when using these antibiotics. Maybe your son can get vomit or have a rash on his skin or just some common symptoms. I think it's okay. I think you don't need to worry about it. But in some babies, maybe under 6 months old, this antibiotic can affect the growth of the cartilage development.
Wow.
Yes, but I think your son is 2 years old already, so it's okay.
Well, the other question is, should I and my wife go to see doctor too? Because I think we both have diarrhea.
Oh, yes. If this bacteria can cause the dysentery in adults. So if you and your wife have a diarrhea now, and you should go to the doctor to take the blood the stool sample to find the blood in the stool.
Wow. Can you treat us?
No, I'm just pediatrician. I just recommend you to go to the other doctors.
But you're also a doctor, right?
Yes.
Okay, so okay.
Maybe I will give you advice, but I cannot have a right to the prescription.
Okay. All right. So any other thing that I should look for my kids when he takes antibiotics?
Yes. This antibiotic is quite bitter. Most of children cannot swallow it because it's very bitter, and so it make parents worry about it. So I think you can add some sugar or honey to make it sweeter. It will be easier for him to swallow.
Wow.
We just use this antibiotic in 3 days. It's just quite short. I think he can do it.
All right. I thank you for your help, doctor. I will take care of that. And if he have any diarrhea, I'll let you know. Okay.
Yes. Yes.
All right. So let me stop right here and let's get feedback from Dr. Doe and Dr. And welcome Dr. Ho. Go ahead,
okay, sorry, I'm a little bit late today. I just have the last minute consult. So I just got in when you were talking about the condition, the treatment is very thorough and it's very clear direction for the parents. And the parents was a little bit difficult with a lot of question, but I think you handle it very well. I really like the interaction. It's natural with the facial expression and then the direction for the patient. I think that's very, very good. I don't have any other thing to say.
Welcome back, Sarah. Comments? Okay. Sarah, can you hear me?
Yeah, I can hear you.
Okay.
Okay, so I think the conversation went well. There's a few things that I do not agree with, but like it's not on the performance on the English. It's on the clinical side of things. But overall, I think it's a good thing. You did good.
Okay. Well, what did you disagree?
Generally, when I did my rotation in the US, we don't use ciprofloxacin for children like under the age of like 8. So
Okay. I have that. Well, as I said, I don't have a lot of experience with kids. I do urgent care work. Sometimes but I rarely use Cipro for kids too. But I don't know. Maybe you guys have any idea, comment, Dr. Ho?
Hi, I'm sorry. I come late. A bit too tired. Just got up. Wayne, can you summarize the case for me? I just missed the most of it.
Okay. Actually, Dr. Ni, why don't you summarize the case for us? And this is why don't you do that in 2 sentences? Okay, 2 sentences. Give me 1 second. Let me unmute. Okay, go ahead.
My topic is dysentery. My patient is 2 years old with bloody stool and loosen stool 3 to 4 times a day. He get fever and vomit 2 times a day, and I prescribe ciprofloxacin for him.
Okay. I missed out most of it. I saw you handle, the question is okay, but I just wonder, I'm not sure why. I just have an impression that maybe I'm wrong, but in Vietnam, I think you probably antibiotic is used a bit too. Ciprofloxacin in Australia, we're very careful. We use it, second line. We don't use it first line at all because that's number one, expensive. Number two, it will develop resistance. So ciprofloxacin usually we don't use for kids. Now, first of all, I think we need to find out what's wrong with the kids. And have you done any investigation to find what bacteria before you start antibiotic? Have you done any investigation before you know which bacteria, which organism called diarrhea before you start antibiotic?
You asked me?
Yes.
Yeah, I'm asking.
Can you repeat again because
I missed your presentation, but I'm not sure. Have you done any investigation to isolate the organism or bacteria, whatever, or parasite before you start the kids on antibiotics?
We follow a protocol from many main hospitals in Vietnam, and they in that protocol they recommend that we can use ciprofloxacin for children more than 2 months old. Although we know the side effect that it can affected the cartilage development, but it just used in 3 days, and so in my hospital we
okay. But the question I'm asking, what do you know what caused the kid having diarrhea?
We have many reasons to causing.
But in your presentation, I'm sorry I missed it, but I'm not sure. Have you identified the cause of diarrhea?
My topic is dysentery.
Yeah, but have you identified which organism called diarrhea?
I see. I understand your question, but yes, maybe from the food of
Okay, all right. Okay, let me put this away. The way how you treat the kids in Vietnam might be different from what we do here. If you're thinking about treating the kids in like maybe in US or on Australia, probably we will not accept your way of treatment. I'm sorry, that's true. Both countries had a different protocol, but again, I think we need to identify what causes it. First of all, we support the kids. You know, first diarrhea. What you're gonna do is you replace the fluid replacement, and try to support the kids, bring the temperature down, and try to find out, what organism causing before you start the kids on. We do systematic, like all the things, taking history, investigation, and before you provide a treatment. Protocol ciprofloxacin, if you happen to do pediatric case in here, in Australia or somewhere, I don't think you will pass the case. We don't use that. No, that's no. We will use your second line treatment. The last thing when doctor when asks you about the side effect, there need to be wording a little bit more, in terms of diplomatic and more professional way, I don't think, I'm just don't use it, I don't think, because that you're the doctor, you provide treatment, you need to know, you don't think at all. I said, from the literature, from the, from the guideline, this antibiotic is safe to use in children, and we have been using a lot in children. We have shown no side effect. No, don't think. I don't think. That's probably they will not, accept that way of, the wording. Maybe the way you think, you talk in Vietnamese might be right, but if you use that term, I will not accept that term from yours because the language is different. And also treatment with adults. Sometimes, I like one of the, doctors who I wrote on Facebook, he came to my surgery, and I think we are trained here. We train in general. We know a lot of other things before we go to specialty. So if Dr. Wintran said, oh yeah, I'm a pediatrician, but I have a bit of knowledge about the adult medicine, I can give you some advice, but I'm not sure my advice will be up to date, and I might. And if you take some precaution about it, and if you're not getting better, then you're going to see your doctor. Something like that. I'm just cut off short. I don't know anything about outside my field. Maybe you know that a little bit. Let's just say I'll give you advice, but take a precaution because I'm not specialized in that field. And the way, but I think probably in way treat you got have to stop. Go straight to treatment. A little bit too far and a bit more. You take a back step a bit. Do all the thing in stepwise. Then go antibiotic, and when too much antibiotic, I don't think it's probably it's too much too quickly. Okay, I'm sorry, a bit grumpy today again. I'm just been very busy week, making a little money to buying food for my children. So, but I will be be nice from now. I'm waking up now.
Okay. Well, here I have and now Dr. Just join us, and also I think of Lydia Wu. She's from Australia too. She currently is a medical student, just finished one of her rotation. Okay, moving forward, let's move to the next case, and we will go there. Okay.
Yes. Thank you so much.
Thank you. Okay, next one. How come we have two DDSS here? One from Play, right?
Hi, I'm sorry, I have one idea.
Yes.
Maybe some mistake here in we would like to present the whole case from the beginning to at the end about the kid complaint, API until to treatment. So you, the mentor, will do as a parent, and I will give a topic on the chat room, and about that.
Yes.
And you make the situation by yourself.
Okay.
Yes.
Sure. Why don't we do that, guy? So everyone, we have several mentors here. When you present, you tell us a topic, and then we based on that, and we will make the situation around that, right?
Yes.
Okay. All right, let's go ahead and okay, next one. What topic are you going to present?
Hi everybody. I'm going. My presentation is 2 years old rise was bring to
Em thì nói về cái topic thôi, rồi bên đó người ta sẽ đưa em situation, em không có tạo ra situation.
Yes. Okay, just tell us the topic.
The topic is pneumonia.
Oh, pneumonia. Okay, so which one is your favorite mentor here? You have several people here. You can pick Dr. New, Adol, Dr. Ho. You can pick Lily. She just came. She just arrived. Dr. Ho. Or me.
I'd like to talk with you.
Okay, Dr. New Do. Oh, sounds like this is one of the favorite. Okay, go ahead, Dr. Do.
Meningitis hả?
Remember, guys, speak loud and confident. Look at to your parents. And Dr. Nudo is a parent of a 2-year-old kid with pneumonia. Go ahead, Nudo.
Hi, doctor. So we start with the symptoms, right?
Yes. I think the symptom is cough.
Okay. I brought my kid here today because he had a lot of cough for about 5 days now, and the fever started about 2 days ago. About 38.5 degree, and he's not eating as well. He's also crying a lot.
And hi Miss Nhi. I'm Dr. Lee. I'm a pediatrician. Today, what's bring you along today? What bring you along today? What brought you along today?
Okay, doctor, my child, he has about 5 days of cough right now, and 2 days of fever, about 38.5. He's not eating well, and he's crying a lot.
And your child has cough for 5 days. Could you tell me more about that? And he have what does it sound like? Dry or harsh?
It sounds a bit wet right now. Seems like he has some phlegm.
And any certain time of day or night?
I don't think so. It's all days and night.
And there is cough up any blood?
So far not.
And there is smell?
The phlegm, you mean?
Yeah.
No, not really. I didn't try to smell it. No.
Yeah. Is that getting better or gets worse?
I think it starts to get worse for me. He looks sicker. He's not as active playing, but he's crying more. He's not eating as well, and the fever keep going. We give him acetaminophen every 4 to 6 hours to control the fever.
And do you notice any nausea, vomiting, or diarrhea?
He didn't seem to have diarrhea right now, but he's not eating as well, so he's not pooping that much. Nausea, sometimes he's coughing and he's gagging out.
And what did you do to treat it? Just acetaminophen or any medication like antibiotic?
We're not starting any antibiotic yet.
And the fever keep persistent.
Yes, 38.5 today.
Yes, and now and will measure his vital signs. Okay.
Okay.
I'm going to examine his lung.
Okay.
And yeah, and I'm allowed to listen his heart sound and belly sound.
Okay.
Now recalls when you take him came here with cough. After asking some questions about symptoms and check him carefully, I need to do I need to draw some blood and do the chest X-rays for him.
Can you tell me how my kids' lungs sound today? Do you find anything wrong, doctor?
Yes, I think your child has pneumonia.
Oh.
Do you know pneumonia?
Not really. How do you know that?
Pneumonia is infections of the lungs that can cause by a variety of germs, such as virus or bacteria.
Okay.
And your child needs to be treated with antibiotic. I will give you prescriptions. This medication will help him to fight infections.
Okay. So do you need the blood test and chest X-ray right now, or you already had the result?
Sorry, I don't catch the words. Could you explain?
Do you get the X-ray result already? The chest X-ray?
Yes, I had the result of blood test and chest X-ray, and
okay.
It shows that your child has pneumonia.
Okay. So after you check my child, after you do on the exam and get the blood test and chest X-ray, you told me that my child has a lungs infection. That's pretty scary from us because we always scared of the pneumonia. Do you think that anything that we need to be aware of for the kid while during the treatment?
Yeah, the medications has some side effects. There are diarrhea or fatigue or nausea. So if he or she has any severe reactions, you must call us right away. And if he has any sign of severe has if he has a severe sign such as he couldn't eat anything or he lie about all the day or he has hard breathing, you should take him to the hospital.
Okay, can you repeat that for me when I need to take my kid to the ER?
If he could eat anything or he couldn't play anymore, or if you see him has sign of hard breathing, you should take him to the hospital.
Okay.
Yeah. Is there something you like to ask me?
Do you think my kid has a hard breathing right now when you check him?
And now, after checking, and I don't see any sign of harsh breathing, so I think I could use medication at home.
Okay. So when I need to go to see you back, or I just finish the medication and that's it?
I will give you antibiotic, and after 3 days, you should take him to me to check again.
Okay.
Okay. Call me back if there is anything wrong with him.
Okay. Yeah, for sure I will call you if I have any concern. Thank you very much, doctor, for taking care of my kids. Do you have anything else?
No.
Okay, thank you.
All right. Very good job. So let me go ahead and go first with Dr. Ho.
Why me?
Well, because everyone here mentioned and they would like to, but frankly, I like Dr. Ho feedback a lot because, as I say, I was very nice for the first couple of weeks, but now this is week 11. I'll be hard on you guys. I expect you to do better, and there's some key when you communicate with your patients, especially the parents. Please go ahead, Dr. Ho.
Dr. Yu, can you do the case with me? And I show you the way how they do it. I think it's completely, misstep, a lot of misstep. And I think the wrong direction and didn't follow the system closely. I don't think we set up the case, not sure how we set up the case were right. So I think a bit conflicting between whether, Dr. New conducting, case or the doctor to see the child. It's a little bit confusing there. So Dr. New, you like to do a quick, brief, case with me, like similar case, like that case, and we, see how we're approaching. I'm sorry, I'm not kids doctor, but I maybe do some way, like more constructive case, and you can follow, see how we do it. And what we do Viva for students all the time, I conduct Viva a different way. So the two ways you can do. If I give you the case, like 4-year-old boy to come in with, with pneumonia, with the chest, been coughing for a few days, and you can tell, okay, now you're acting as a doctor, said, what I'm going to do. What I'm going to do is I'm going to ask all these questions. You ask all the questions, how long I had the cough for, and any cough, any color of the cough, any blood in there, and anything to relieving. And you ask, next I want to do check an examination. First of all, I check the vital sign. I check, I listen to the chest, and I check the sputum. And next I will do some investigation. I might do the check the blood count, and I do a chest X-ray for kids. Then if the chest X-ray come back showing any consolidation this way, then I will put a kids on intravenous fluid and give an antibiotic and monitoring. So that's one way you're approaching. The second case called role play. That means, Dr. New and I will do the case. I'm asking her the question and she will return the question for me. There are two formats you can do. First, you're acting as a vibe called OSCE, that's the way how we do it. Second case is role play. So I think a bit, in your case, a bit unclear between OSCE and role play. It's a little bit hard for you. Yeah, but I think you need a bit more, systematic, try to follow the format, taking history, and then in the examination, then investigation, and you formulate, the diagnosis and you provide the treatment. So because the way in Vietnam, probably the way I spoke to quite a few doctors so far, because you've seen about 50, 60, 100 patients a day. You don't have to follow the structure. You just go straight, okay, pneumonia, bang, you tell the nurse to write, and this medication, bang, bang. So you get in the habit that way. That's why you guys have so much problem with, like follow our way of teaching and our way. Because we guide, you guide people into the way how, if you come to this country or other country you work, you have to follow this system, because you have to break the habit of you using all the, bang, 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 bang treatment. You don't have time to think. So from this opportunity, you try to do this way. See, 2K, OSCE or Viva, okay? I say, now I'll go back to do this simple thing again. It's a patient, for a 2-year-old child coming with cough. And I said, I'm a doctor. Do you like me to do role play, or you want me to do the case? It's simple like that. And okay, I want to do the case here. First of all, I have to take history. We know the way how you're approaching systematically. And I will see, and after you formulate, and I'll do, examination. You asked you how do you know that pneumonia, because you didn't listen to the chest. How do you know pneumonia? Did you check the side? You do percussion. You do, the air entry on both sides. You see, a lot of things you're missing, and you don't. You're just so quick into it. Most of the doctors in Vietnam has the same problem. You make a diagnosis very good, but so quick. It's not the way if you want to pass exam. It is not. And it is the way how we try to frame up the doctor, go back to systematic, do the right way. Once you get in the right way, you do this way, you can be very quick. Like I see patient in 5 minutes. I can see patient. I can't make money if I see the patient 30 minutes. I can see 10 minutes. I can do everything in one go, because I have to stick to that system. I told all the students, Dr. Wintran, I keep whinging about all the students. You have to stick to the format. You don't stick to the format, you keep, flopping around all the time. For say 8 weeks, you're good to try, but you can't break the habit. That's the way. That's why we feel frustrating the way. Dr. Nudo try to prime you up all this. You're still getting a bit of trouble. So I think probably don't take it that my harsh, like judgment. But I think that because I will feel for Dr. in Vietnam, where you see so many patients, you don't have time to do this stuff what we do here. But once you break the habit, you be a great doctor. You do that, you don't miss anything. You can do in 5 minutes in that system. Dr. Yudo can see, patient 5-10 minutes. You can do the whole thing in one go, because it's in here already. System, medicine is a system. You don't get a system in your brain, you don't do medicine.
Well, thank you for the great and well, so let's do it this way, the class. Dr. Ho, that's a little bit misunderstanding, and you're right. Because the intention of those cases is they go on to tell you a topic, and then they will walk you to the mentor supposed to create a situation or a real case. And I'm not sure how much I can see both from both ends, and I completely agree with you why we need to follow systemically. But I think our students also like to improve their communication skill at the same time. So let's try to find a new somewhere in between, and let's go forward with that. And hopefully by this is week 11, and you guys should follow systemically and like what we try to emphasize. Okay, and that's why Dr. Nudo asked you, how do you know this is pneumonia, and those questions. All right, let me yes, Dr. Nudo, go ahead.
Yeah, can I have some comment
yes.
for G? The first thing, I think that I give you the history. You might need to a little bit more expanding the history. Make sure you have a negative symptoms and confirm on those positive symptoms that the kid has. And you might need to make sure that how the vaccine and how the allergy of the medication is really important for you to know that, because that will guide you through the treatment. You cannot get antibiotic without knowing the kid not allergic to that. And the same with sick contact. Anybody got sick, any tuberculosis, for example, and then it will guide you in different certain way, different differential diagnosis also. And then when you present the examination, I think that a little bit quick on this, but you might need to make a bit more expand. For example, okay, I checked your kid today, the vital signs, your kid has a fever 38.5, he has the difficult breathing that I can see because of the fever. Sometimes again go up on the respiratory rate up to some certain number, and you can give a little bit vital signs in there. When I check, and this one for sure you need to check the ear, nose, and throat. You cannot just jump up into the lungs and the heart and the belly, because they might have just ear infection, they might have just sore throat and things like that. So on the top of the fever. So I hear the lungs have some crackling. He has no difficult breathing or something like that. You need to mention. The heart looks fine. The belly looks fine, soft. I don't see anything that look like he has a acute abdomen. Then because of those symptoms, this, the fever, the cough for 5 days, the crackling in the lungs, then I think that it looked like some kind of infection in the lungs. I need to get the blood test and the X-ray. So, and after that, you go up, you go down to the, right now you have a blood test and the X-ray coming back is a little bit elevated of the white blood cells, or the X-ray look like a local pneumonia on the right lung, on the left lung, upper lobe, lower lobe. You need to detail on that. Then with this one, it's likely that they have bacteria infection. You will need to get a treatment by antibiotics. And because no allergy, then you will go ahead and treat by this medication for how many days you plan to, what symptoms that the parent need to look for at home in order to come back to the ER or to follow up with you in certain day. That's why you need to get a good plan for them before you send the kid home. Yeah, Sinhet.
Thank you, Dr. Noodle. Any feedback from the panelists? Lily, right? Go ahead. Go ahead, Lily.
Can I say now?
Yes.
Oh, okay. Sorry, this is my first time, so I have no idea how to actually the system actually works. So just the introduction. My name is Lily, and I'm just finished my third year, hopefully passed my third year of the MD degree. So I have one more year to go. Sorry, I'm in beach as well. Just wake up. Sorry.
Okay.
Also, so back to the case. Yeah, I think first of all, thank you so much for coming. Spend your Saturday morning and learn things in the plan home. Just advice about things. I'm probably the lowest trained here, so please disregard if I say anything that doesn't make sense, because I know all of you are trained doctor and I'm just a student. So, but first of all, with the symptoms, I think it's also important to check whether the kid have some sort of underlying asthma. In Victoria or in Australia, so many kids have asthma. So whenever there's a kid coming in with pneumonia symptom, I will ask about feature of asthma to differentiate. I also would like to quickly check, because he's 4 years old, I would like to check for developmental milestones to check whether the kid's development well. Just ask them walking, whatever, all the 4 developmental milestones for children. Because if the kids develop well, then I know that, well, he's healthy and things like that. If I find that he's falling back in any of the developmental milestones, then I'll be more concerned, about not just this episode, but also a kid as a whole. So, yeah. Also, ask about maybe siblings at home as well. Does he have any siblings, any symptoms that the siblings may have? Sorry. If my comments are unnecessary, I'm just a student, so.
No, I think those are good comment, because, well, first of all, if I do agree those are good comments, and any other from Dr. Dong Dang or Queen Do, I think, yes, go ahead, Queen.
I'm gonna just have one thing. I since everybody already talked about the specific of the case, I'm just talking about the way you present yourself. So I feel like you're very nervous in this case. Like I can sense the nervousness. You know, it seemed like you asked the question, and I had the same thing when I first came out. I came to see a room and I have like 10 questions I want to ask the patient, and if they answer something out of that, I lost track. So it seemed like you asked the question, but you don't really pay attention to the answer. You already have the next question in your mind, or I'm going to ask this question next. So the other way to help, the one way that I feel like it helped me a lot is just ask open-ended question. Like if they ask about coughing and you want to know more, just tell me more about the cough. And then that is an open-ended question. Allow the patient to say, okay, it's cough, like it's red, it's sputum and stuff. And then instead of going to specifically say cough, diarrhea, something, just ask them, besides the cough, do they have any other symptom? Just to allow, that's an open-ended question to allow the patient to tell you more and give you more time to think, you know. So I think that's, so two things, just be more confident and assertive, and then ask more open-ended questions to give yourself more time.
Thank you, Queen. All right. Sleeping Dr. Dong Dang. Any other comments?
Sorry, I came in late, so I didn't hear the whole thing.
Okay, that's okay, guys. Okay, next time, just if you have comment, that's okay. You don't have to mention that. All right, so let's move on and keep show going. And next time, the rest of the class, we try to go systemically, try to go over open-ended question. Okay, and we go from there. All right, thank you. All right, who's the next one?
Hello.
Hello. All right, I want you to speak loud. Again, try to speak loud and confident. Okay, go ahead. Pick one of your mentor and we go from there. Tell us a topic.
Yes, my topic is about meningitis. Meningitis.
Meningitis. Okay. Oh, go ahead, Dr. Ng. And who is your favorite mentor?
I want to talk to. I would like to talk to Dr. Winter.
Okay. Okay, go ahead.
Hi, Mr. Wing. I'm Dr. Ng. I'm a very aged physician. Today, I'm your son's doctor.
Right. Thank you, doctor. Thank you for helping my son.
What brings you here?
Well, my son have I don't know, he's very irritated. He crying a lot and seems like he has some type of back pain or headache.
He's headache pain and cry a lot.
Yes.
When this symptom start?
Just for a few days ago.
Few days ago.
He also have some fever, vomiting, and then I don't think he look well. He cry, actually he smile a lot with me, but he's not smiling today. So something wrong with him.
Yes, and this symptom is constant or sometimes it come and go?
Yes, it's most of the time it's constant, and then sometimes it's come and go. But right now I think it's always. I don't think he's doing well.
Did you do anything to relieve this symptom?
I tried some Tylenol, some syrups, some liquid Tylenol, but I don't know. He doesn't look well. Something wrong.
Yeah, what make it worse?
Or if I try to sit him up, try to move his head, it really bother him. So, and whenever we try to move his legs, it does also really bother him.
Yes. And have you used any medication?
I try, as I said, I use Tylenol, and that's the only thing that I try, and it doesn't work. So that's why I brought him here.
Yes. And is he diarrhea?
I don't think so. It's just fever, headache, and unwell. No.
And is he high fever or mild fever?
High fever.
Yes, high fever. And has he had a rash?
Yes, he does have some rash too, and I feel like his neck is really stiff. I feel like if I try to move it, it's really painful for him.
Yes. And now I will examine him.
Okay.
Yes. I see he a lot. Yes. And his neck is stiff.
Yes.
And pain.
Yes.
The viral vital size is normal, and he has some rash on his skin. And now I will order some tests such as blood test and lumbar puncture.
What is that?
It's a procedure in which we use needle to throughout the spinal cord to test this the cerebral spinal fluid to analyze what's happened.
Well, why he needs to have this procedure? I don't understand why.
Because after history of illness and examine and physical examination, I suspect he has meningitis. Do you know about meningitis?
Wow, meningitis. What the heck is that? It sounds not good to me.
It's inflammatory infection brain.
Brain infection.
Infection meningitis, which this is membrane covers the brain and spinal. And now I suspect it's infection.
Wow, it sounds serious. I don't know what it is, but it sounds serious to me.
Yes, this is a quite severe disease.
Wow, is it gonna be painful?
Sorry?
It's gonna be painful for my kid. I just want to make sure no pain for him.
Yes, it's cause painful. He feel rest day.
Okay.
Yes.
Do you have to do this? Because if you told me you know the diagnosis, why you have to do this procedure?
Because to diagnose exactly this disease, we need to test cerebrospinal fluid.
Wow.
And we need to take a lumbar puncture.
I don't know. I think he doesn't feel well at the moment. Can you do it later? Can when you get a little bit better, can you do that later?
Yeah, but don't worry. We will use release pen before do this procedure.
Okay. All right. And let's say if my kid has this whatever you call mini something, what is the treatment? Can you cure my kid?
After do blood test and cerebrospinal fluid, I will diagnose it exactly. He has meningitis or not.
Okay.
And in this disease, the cause is caused by virus or germ.
Okay.
And we need to use antibiotics for him if it's a bacterial meningitis.
Okay. Well, it sounds like serious conditions. And okay, doctor, whatever you want to do, I'm okay with that. I just make sure there's no pain. I know he's a strong boy, but he hates needles. So I don't want that. But anyways, are you going to give him anything right now? Because he doesn't feel well.
I think our baby is care needle, but in this situation, IV antibiotics is needed, and we will do it slightly, and I think it's not so painful. It's not so painful.
Okay. So you're going to give my kid antibiotic right now, right? Or you will wait after the procedure to see whatever the lab result is?
Sorry, I can't catch your...
Are you going to give my kid antibiotic right now? Or would you wait after your test, whatever thing that you told me, and then you give him antibiotic?
I will do a procedure before.
Mm-hmm.
Yes.
Okay. All right. Thank you, doctor. I don't know what to do right now, but I just help you treat my child. Thank you. All right. So let's stop right there and get some feedback. Let me go around the room first because who haven't commented so far. Let's see. Let's go back to Queen. Okay, Queen, what do you think? Oh, by the way, Queen, you're not on your wake call anymore? Okay.
Too hot in here. Too much heat from Dr. Hall.
All right, so, Dr. Hall told you that you do not take one more layer out, okay? It's very hot. Just stop right there.
I won't. Okay. So I think Similar to the previous person, I think you have too many specific questions and not not enough open-ended question for your history. And then for the lumbar puncture, maybe you can explain a little bit more clear the process of how you do it, you know, and how you're going to make the patient not in pain, like by either local medication or deep sedation or something, how you do it for kid, and also how you're going to do it safely and the possible complication of that. And then when the family asks about why the need to do the lumbar puncture, I think you can do a better job of explaining, you know, is the best way, or that's how you get to the correct diagnosis. That's otherwise you're gonna treat blindly. So if you can tell them the benefit of why you're doing it, it make them more reassured and more willing to take the risk with the procedure. That's what I get so far from this case. That's it. Anyone else have any comment? Go ahead.
Okay. So the questioning is one of the open-ended question at one way, one good comment that always going to work well for you guys when you start learning English or learning how to take a medical history. So open-ended question is very good. But let me ask you more of the technical aspect. So what do you miss on the physical exam that will help you a lot? What do you think that you were missing on the physical exam? Can you describe to me what you exam again? So can you tell me how you exam the patient again?
I think I need exam the whole of the body.
Okay, so why don't you go systemically and exam the patient for me the way you want to examine the patient?
I will examine her neurological.
Okay, what are you looking for?
I will see here allows or stimulate or coma.
Okay, so the patient is crying. It's very angry, kind of look from based on what Dr. Huỳnh told me, he's crying. He's very uncomfortable. Okay, what other neurological sign are you looking for? So you know your case is a meningitis, right? So you have to know, beside the general exam, you have to look for very specific clue that will confirm or at least suggest to you that it's meningitis. So what are you looking for in the neurological exam? What do you want to examine and what are you looking for?
I want to find some sign such as stiffness neck.
Okay, stiff neck. So how did you how did you exam for the meningeal sign? So the stiff neck is called the meningeal sign. So how did you elicit that exam? Okay, so those are something that you want to go back and look at the physical exam for meningitis and look for specific. So you want to be able to elicit the meningeal sign. You want to make sure that the child is not having hyper intracranial pressure, high intracranial pressure. So you need to make sure you do an eye exam, ophthalmic exam, looking for edema, or you also can shine the light to the light and you have sign of photophobia. Okay, so you need to learn how to do the meningitis sign. Make sure you do the photo exam to make sure that the kid is actually having photophobia, right? Okay, so those are the two main things in the neurological exam that you can look for. And so when Dr. Huỳnh asks you, how would you do the lumbar puncture? So I want you to describe to me how you would do the lumbar puncture. Because the parent is very scary, right? You need to reassure them that it's a procedure that you need and you have the ability to do it, and you have to describe to them exactly how you do it in a term that they can understand. Otherwise, you will just scare them even more. So I want you to describe to me how you would do a lumbar exam or lumbar puncture on a kid.
This is procedure quite painful and cause scare for baby and parents. And before doing this procedure, we will use and pain reliever drug. We use pain reliever drug.
Okay.
Yeah. Before do this procedure.
No, I want more than that. I want you to tell me step by step how you're going to do it.
Yes. First, I will use pain relief medication for him to help him sleep. And we step 2, we will needle to through spinal cord from her back, his back.
Okay.
Yes, and take a blood sample from that to analyze.
Okay. And so he also asked a lot of questions about the treatment part too. So now this is a child that you suspect meningitis. And so he wants to know, how do you treat the child right after you do the procedure? It's going to take a few hours, or at least a few days for the culture from the CSF to come back, right? The fluid, it's going to take a few days for you to grow the bacteria, or a few hours to at least gram stain it before you can see anything. So in this age group, what are the common bacteria and virus that cause meningitis, and what antibiotic are you going to give to treat them?
We will beside exam the patient, we will consult the result of complete blood count and cerebrospinal fluid and some tests such as CRP or procalcitonin, serum procalcitonin, to assess it either viral meningitis or bacterial meningitis. The result of complete blood count is quite quickly, about some hours.
Okay, so let assume that you're not the primary doctor anymore. Let's assume that you are an infectious disease doctor, and I am a primary care doctor that's seeing Mr. Huỳnh Chao. And I'm calling you and I say, I have this child that I think he have meningitis. I did a lumbar puncture already, but I don't have a culture coming back. He have a high fever, he have meningeal sign. what antibiotic do I need to give this child? What are you going to recommend for me?
I will use ceftriaxone in first.
Ceftriaxone, you say?
Ceftriaxone. Do you know about ceftriaxone?
Ceftriaxone, you mean Rocephin?
Yes, ceftriaxone is
Okay.
a 3-cephalosporin.
Okay. Is that it?
I don't know exactly what kind of bacteria, and
you don't know, right? You don't know, so you're assuming you have to treat everything. And so the important is that as a child, what are the bacteria that is commonly there, and what antibiotic you have to cover without knowing what the bacteria is. And so those are the kind of level that you need to know when you explain to the patient what you're going to do. So when you know all this thing that you want to do, it will make more sense when you tell them what you want to do, because antibiotic alone, it's very broad. They will not know. And then so sometimes you have to be a little bit more specific. You need to know so your topic is meningitis. So I'm assuming your job is to tell me everything about meningitis that you know before you interview me. And so that's what I want to know. Okay.
Okay, thank you, Dr. Dong Dang, for awakening everyone. Even though your specialty is sleeping medicine, but go ahead, Dr. Ho.
I'm sorry, I probably need to go now. The hospital call again. I need to make money. Okay. I think it's, Dr. Dong really replaced my job today. So great, thank you. I'll be nice. So she handled pressure this week really good. I like it. 2 weeks ago she really, almost, couldn't do it. But this week she handled quite well. But put all the question a little bit, not very. You have to put in, some sort of bit more professional, and some follow the question clearly. I leave it for Dr. New will make the comment about this one. But meningitis is emergency. The thing is, it's not just a simple thing. It's emergency. Could affect the kids. Could lead to amputation. Could lead to epileptic seizure and long-term effects. So you need to think meningitis has to be a bit more, putting more context in more emergency management. You take a question quickly. You make a plan really quickly to go into. Meningitis could be again viral or bacteria. Most commonly, virus, just bacteria and encephalitis or bacteria, bacteria meningitis, and most treatment kept showing it right. But lumbar puncture, you need to know clearly, because when you explain to Dr. Wintran, very concerned about his son, blah blah blah. This you have to look lumbar puncture. If you do see a few times, you can tell very quickly. Systematically, you know that you put yourself back into how did you do lumbar puncture. You explain to patient next line, you sedate the kids, or local, and you prep, and you put the needs of the L2, L3, and you take a fluid out. When you take fluid out, what you need to look at the fluid? You look at protein, look at white cell, explain. Just one simple sentence. But if you have done it before, you probably wouldn't be any trouble. You need to explain to the patient and clearly. Okay, so I think probably, and also the question probably, more, all the photophobia, irritation, and, looking for rash, especially rash is very important in meningitis. And when you do that, I think probably good. But I'm glad you handled the question really well today. You handled the situation well. Need to be polishing up with the open-end question, everyone. Okay, have a good day, everyone. Gotta go. Woman can't wait. Okay, thanks. Bye.
All right. Before I hand the microphone to Dr. Nudo, and I think Lily want to say something. Well, Lily, welcome. I'm very excited to see more comment from our feedback from you guys.
Sorry, I was actually waving goodbye to Dr. Fu. It's not really like me raising hand to give comment.
All right.
But
okay. So I will get you back to eating, okay?
No, but I can give comments. I can give comments. Sorry, because I was eating. So I think with the case back to the examinations. As for me, I don't know how it was taught, but for me, I always start with general inspection first. So because when she replied me, she told me that she would go to intestinal neurological, but I think for me, I will always inspect first and then inspect the kid very closely. And I will also inspect how he interacts with his mom or whoever brings him in to test for like how severe, how irritable he is, or any rash, anything. Also get a general rapport with the kids first, because if I just jump in and then touch the kids, I think like I will break the relationship with the kids straight away, as like, I'm a stranger to the kids. So I'll start inspect and then talk to the kids, and then of course quickly because she has meningitis, but I would start with some rapport and inspect. So that's first comment. And with the also I would like to ask a bit about history of like febrile convulsions or any previous histories that of any illness he may have in the past. What else? Yeah. Also, yeah, I'll start with that, and then go to the next person. Sorry. Yeah.
All right, thank you. All right, so the rest of the group, Dr. Do, Phing Do, and you Do.
At first, I think I agree with Lily, because we need to be approaching in a certain way, in very detailed, quick but detailed. With the kid, you want to make sure that you see general, like as she said, and you do whatever you can do without making the kid cry more. Then you go to do something that you make the kid cry later. You know that, like, check your ear, nose, and throat. You cannot omit that. You need to do it. Make sure that she's not having an ear infection going causing mastoiditis and causing meningitis later. So everything you need to check. But I will do the heart and the lungs after, because it's kind of easier. Tummy might be also before you irritate the kid and make her cry. And then after the stiff neck, also it's really hard, the case that if they cry and they stiff neck, to make sure that how do you elicit the stiff neck without mistaking it. Sometimes the kid was just like that, and then it's already stiff. It's hard for you to define that also. So this is my experience on finding the kid. So make sure you do an examination. I didn't hear about sick contact, about the vaccine, about allergy, blood test and LP. I agree that we need to do. I agree that we need to put kid on medication right away, pending the result. Yeah, I think that's all I want to say today.
All right. Thank you, Dr. Do. Queen? No? All right, so here's my comments. When you explain a disease like meningitis, and when I ask about the meningitis, the way that I explain to patient, I try to tell things very simple. You said, you know, there's a brain and the inside, so that's a very thin layer cover. And many times that layer can get infected, and that we call meningitis. You can explain like that. And because of that, one of the best way to look for infection in this layer is we look for fluid around that. We call brain fluid. When you talk about cerebral, nobody knows what it is. When you talk about terminology, people will either look at it like, okay, go very simple. This is emergency. This is emergency case. You like to know, you like to express to the parents, no, this is a very urgent, this is important to have the test. So you tell them that this is what we're concerning, and this is one of the best tests to look for. In order to see that fluid, we will use a needle and try to get fluid. And that's how I started. That's my comments. The other way that when I asked you about waiting for versus give treatment immediately, and Dr. Dong Dang already asked you this is emergency. You have to give treatment, and the whatever culture come back later. And this is important. You explain to a patient that because they can sue you. Seriously, they can sue you later if there's a sequela or consequence of not treating, and you telling the parent that you will wait or whatever. So you have to do the procedure, and then while we may not have the result yet, but we likely will give your kid treatments. Okay, so that's two things I like to comment on that. I am going for conference downstairs real quick, and I go back to you guys. Why don't you go ahead? Don't pick me as your mentor anymore, because I will not be here in maybe half an hour or 1 hour. Okay, go ahead. The rest of the class.
Thank you. I like to say thank you. Maybe I want to explain something, but it's so difficult to explain. When you say that, I see everything is easier.
Don't worry, it will come, especially after several treatments from Dr. Dong Dang. You know, it will make everyone not sleeping anymore, and then Dr. Queen give you some cardiology pressure, and then Dr. Newdall. So you do fine. Don't worry.
Yes, thank you.
All right, Lily, you have a comment, or you want to say goodbye?
Yeah, one more comment. For me, I would also quickly check, assess the kid fluid status, because if he's been irritated and we will worry about dehydration, we can also lead to a lot of problems in kids.
All right.
Yeah.
Thank you. Okay, keep go ahead. Dr. Newdall and Dr. Quindle, I'll make you guys a co-host so you can mute, or you can the audience, because sometimes when we listen to the Vietnam from Da Nang, it's better if we can mute them after we finish so we can give feedback. All right, go ahead. Next one.
Next one. Okay, I would like to talk to Dr. Newdall about then hemorrhage fever.
Wow, that sounds like a very interesting topic. Okay, so Dr. Newdall and Quindle, you guys are now co-hosts, so you can turn on and off or mute anyone you like, basically.
Okay.
Go ahead.
Dengue fever, right?
Yes, okay. Hello, I'm Dr. Hien. How can I help you?
Doctor, my child, he's a 2-year-old, and he has a fever for about 3.5 days now. Really high fever, and he's not look well for me. Can you help me to see what he has?
So your son is 2 years old, and she has high fever for 2.5 days. What is the highest temperature did you get?
I think about 39.5.
39.5. And which medication did you have to use to reduce the fever?
I use some acetaminophen at home every 4 hours, and sometimes I need to get him some ibuprofen also to control it.
And the temperature reduced or not?
It's reduced for about 1 or 2 hours, and it's coming back.
Besides fever, does he have any other symptoms such as refuse to feeding or?
Yeah, he seemed to be irritated and not feeding well for about more than 4 days already.
Did he vomiting or not?
He did have some vomiting.
And did you find any blood or anything different in the his vomiting?
So far not. Just the food that I gave him, and then sometimes with medication, and sometimes just clear liquid.
This is coughing or cough?
Not really bad cough. He has some mild cough only.
And does he pee or poo-poo is okay?
I think that he's not eating well, so it's not as normal, but he's still able to pee.
I would like to ask, any other members in your family has this symptom, has a fever?
So far, no.
This is take the vaccinations enough as his age?
Yes, he's up to date.
Oh, thank you. Now I will examine him. At first, I will test the temperature for him.
Okay.
And he has a fever now at 39 degrees. And now I will test the pulse for him.
Okay.
The heart rate and the lung sound. I will examine his belly. And okay, she has some bruise in the leg. Have you seen this bruise before?
Yeah, I saw it maybe about 2 days ago, but I think that because he's running around, so he got it. That's why I didn't pay attention that much.
Okay.
So is it something that I should worry for?
Yes, because she has a fevers and have some bruise, maybe one kind of bleeding in the skin, and I have exams on of his skin. There are no other signs of symptoms, so I need to do the blood count, the test for him. As you know, we live in the dense hemorrhage epidemic, so I would like to do the test for exclusion of dense fevers for him as well. Now I will test. I will draw the blood for him.
Okay.
Okay.
So, what is a dengue fever, doctor? I think I hear about that. I heard about that before, but I'm not really paying attention until now. You noticed.
Yes. We will do the test, and I will explain you about this. Okay.
Okay. So what test you want to do?
I will do the blood count test and the blood test to identify whether there is a dense virus in your body, in your son blood or not. And now so it is a result of him. As you know, your son is 2 days, 2 days and a half of fever, and we find bleeding in the skin. And now we done the test for him, and we find that there is a dense virus in his blood. So I have to tell you that your son has dense hemorrhage fevers. I will explain you about this. It's one kind of disease which caused by virus, and the babies will have a fever and bleeding in some organs of his body, such as in the GI, that's true. The intestinal, no, the skin bleeding. Yes, thank you. The gums bleeding, nose bleeding, gum bleeding, and this disease can transfer from one person to another by the mosquito.
So,
and I would like
with that, does my child can die? Can my child die?
Some case of disease, the patient can recover soon after 7 days. But a little case, the babies may have a severe hemorrhage, severe bleeding, and we have to cover at the hospital. Now I would like to tell you about the treatment. As first, we have to control the temperature for him. We use acetaminophen to reduce the fevers. It 4 or 6 hours if he gets the high fevers. And he should drink a lot of water. And you should take care of him with soft, solid food, easy to eat. But remember, don't use rice food. Add tomato or watermelon, because when she vomiting, we can difficult to diagnose is this the bleeding of the gut, or it is the colors of the food. And you also have to see the stool of your son. If the stools go darken, you have to know that it is one kind of gut bleeding. And if you feel that 2 days later, your son gets the less fever, not fever anymore, but he not feel well, be fatigued. It's also one kind of serious condition, and you have to come to the hospital. The virus have no treatment, specific treatment, so only use the to reduce the fevers and drink a lot of water. And we have to look after the dangerous signs for your baby. And, to reduce the risk of the mosquito can bite him and spread the disease to all of your family, you have to use a mosquito repellent and sleep in the mosquito net. And if any other people in your family gets fever, you have to take them to the hospital to identify is it has then hemorrhage fever or not. So do you have any more questions?
So can I continue the ibuprofen on my kid or only the Tylenol? Oh
yes, it's a one reasonable question for this. You should not use ibuprofen. You have many medicine to reduce fevers, but in dense hemorrhage fever, you should not use ibuprofen and especially aspirin, because it can cause the gut bleeding for your son. So only acetaminophen and use in appropriate time. The intervals must be 4 hours or 6 hours. Because if you use less than 4 hours or 6 hours, the livers of your son can be failure.
So do you check my kid liver already? Should I be worried for that?
It's only on the 2 days of the liver function can be deteriorate maybe 4 or 5 days ago. So at first I haven't tested.
If 2 or 3 days later you can come back and I will examine for him to make sure that she should take the test or not.
Okay. And by the way, is it anything I should worry about the bleeding problems? Because I think that my family has some bleeding problems. Somebody also have easy bruising and nose bleeding. So should I worry about this also?
So have your son ever nose bleeding or gum bleeding before?
Yeah, sometimes he has nose bleeding.
In the test, the the numbers of the platelet is what's component to help reduce the risk of bleeding is normal, but it's not mean that it will be okay in the next days. So when he has the signs of nose bleeding and gum bleeding, please come to visit us soon.
Okay, okay, I got that, doctor. So when I will need to see you back? Is it in 2 days I need to make appointment to see you?
Yes, you should come to see me 2 days later because the complication of the dense hemorrhage fever often occurs on the 4th or 5th day of the disease. So please come to me. I will check the conditions of your son and give you more advice later.
Okay. If not in the morning that I can see you, if it happened at evening and at night, should I take him to ER, emergency room?
Yes, you. So I'm in the clinic or in the hospital now. You mean that I am in the hospital?
Oh, so you are in the ER right now. I'm sorry, I thought you were in the clinic.
Yes, I have to know if I am in the emergency room or the outpatient clinic, I should advise him. You should go to the hospital if they have any signs of any sign that I have a list to you, such as nose bleeding or gum bleeding, less fever but still feel not well, because the disease can go bad very quickly. So don't waiting for the morning because you can go to the hospital. Our hospital do 24 per 24 hours.
Okay, I got that, doctor. So thank you very much, doctor. Is there anything else that I should know?
So in brief, I want to say that your son has dense hemorrhage fevers and you should drink a lot of water for him and use acetaminophen to reduce the fever. And if there has any signs of bleeding or feel unwell, come to the hospital as soon as possible.
Okay, I got that. Thank you, doctor.
Yes, bye-bye.
So I think that is very complete case. I didn't see it a lot in here. I don't have only have one kid with that. And we often ask about the travel history. Also, I think in Japan it's different because the dengue fever is everywhere.
I can talk to you. No, that's all right. That's all right. Yes, that's all right.
Thank you, Anh. And then I think that the history you might need to ask also about any bleeding disorder in the family, because the bruise can caused by something else, and it's just go with the fever and you get it together, become the dengue fever. Sometimes it's something else also. Negative symptoms. You might need to make sure you mention something, any Any other symptoms that you got? Or you can make an open question like a Dr. Huynh just say, any other symptoms I should know? And anything I miss asking you question. Then the parent might need to tell you something else, like a bleeding disorder or have a bleeding problem in the family, thing like that. Then you might need to add the PT, PTT in there to make sure that you screen for the bleeding problems. And the test, I'm not sure that the first test you do is only the CBC and the dengue fever or anything else. Beside that, I'm not sure. Because the temperature every 2-3 days. Is anything else beside the fever? I'm sorry, beside the test only for dengue. Maybe urine infection, something else. You might need to check the urine also to make sure any bleeding in there. Yeah. Any bleeding in the GI tract, the GU tract.
Excuse me, Dr. Newdo and Dr. Quindo, could you just try to mute and unmute the Da Nang group? Because sometimes I think Dr. Ung or Dr. Hing would like to say something and she could not. Only you two can unmute. Can you try it?
I just unmute myself. I couldn't.
Okay. So on the corner of the on the upper one, you should see everyone on the windows, the tiny windows. And then you click on that, and when you move your cursor to that picture, that's a mute or unmute. Click on that thing.
Okay.
You see it?
Good.
Can you try to unmute her from Da Nang? Because I'm leaving in a couple of minutes, so I'm not sure you guys can. Oh, that's you. No.
I'm using my cell phone, so I don't have the same. I may not have the same picture as you.
All right. How about Da Nang group? Can you unmute by yourself? Can you do it by yourself?
Okay, it's okay now.
Okay, sure. So whenever you guys talk, you can mute from Da Nang because it's very noisy from Vietnam. And I try to mute everyone else except the speaker. By this way, we have a better quality of sound. All right?
Yes.
And keep going. I'll take it in 5 minutes, but you guys just keep going, okay?
Yes.
Okay. Okay. All right.
Yeah,
yes.
And then mosquito. When you talk about that pronunciation, what else? You might need to do also what you shouldn't give the kid, because that seems to be aggravating by ibuprofen or aspirin. You might need to make sure you emphasize on that. How about the vomit? If the kid has vomit, what you want to do? Any dehydration situation you need to be worried for. Yeah, the good thing that you cover for the family, for the preventive treatment. That's all. I think that's all. Thank you.
Does anyone else have any other comment? Sarah or Lily?
Yeah, I think this case well prepared. You definitely know your material well. There's some pronunciation problems: mosquito, dengue fever, not dengue fever, and hemorrhagic fever. Okay, and yeah, I think you should like when you talk about the disease, the dengue fever disease, you say that it caused by a virus, which is correct, and then you said that it caused hemorrhagic fever. But I think you should like also mention that it can cause like a different kind of manifestation. It can be like mild without any like serious symptoms, or it can be very serious. So like because like when you talk about like it caused bleeding and all that stuff, and then you just like tell the mom to like let the kid go home and drink water, it will cause her to be like confused because like, why my kid have so severe disease and then you tell me to get my kid home and drink water? It like some parents will get annoyed with that. So I think you should say to them that like it have a lot. It can manifest like differently in different cases. Most of the time it's just like some fever, some for a few days, a little bit tired, but most of the time it's okay. But on the rare cases, we do see some hemorrhagic problem, which we worry about. So if you see any problem at home, then bring him back immediately. And I think it's easier for the parents to accept that. Yeah, that's all.
Yeah, just a minor comment from me. I think you did a great job with a difficult case. I don't have many experience with the dengue fever, but I really like that you mentioned like what kind of food to avoid so just do not confuse the symptom of bleeding versus from the food. I think one thing I would say is that since you mentioned a lot of serious complication of this disease, and you send the patient home, like Sarah said, maybe you should explain to the mom, these are the serious possible side of complication. But the reason I'm sending you home is because your child's vital sign is stable, no, the fever is controlled, or whatever, or lab count doesn't sound really dangerous. That's why I can send you home with closer follow-up. And the other thing that's helped is to offer them, call us anytime, maybe give them a contact number, call us anytime if this and this happened, which you did, but probably just give them like a concrete number or something to call. And then I was going to comment on the summary of the case because it's a long case, but you did it right at the end. So that was the last point I was going to comment. Yeah.
Yeah, that's a very good one. Very good presentation. You sound very confident.
Yeah.
Thank you, Ji.
Hi everyone, today I present intestinal obstruction. I want to present it with Dr. Win.
Dr. Win is at a conference, but I'll try my best to imitate him. Looking is him. Okay.
Okay, I want to present with Dr. Quyên though.
Okay.
Hello, I'm Dr. Vũ Nguyễn. I'm pediatrician. How can I help you today?
Oh, hi, Dr. Vũ. When my child is, I have a 2-year-old son who's not eating at all, and he's keep vomiting up blood for the last few days.
Where did it start?
What happened?
Where did it start?
It started about 2 days ago. He's just like everything I feed him, he just vomit up and cry a lot of pain and pain in his belly.
Mm-hmm. What about his nutrition?
He can't eat a lot. He's better when he's not eating. When he eat or drink, he complain of pain and crying. So he's not eating too much in the last days.
And did he have stool?
He hasn't eaten anything, so I don't see any bowel movement.
How many days he don't have stool?
About 2 days now. That's why I'm worried, and I bring him to you. Usually he has bowel movement every day, a couple of times a day even, but last 2 days no bowel movement, and a lot of belly pain, a lot of pain in the stomach.
What thing can help him better?
It seemed like not eating is better. When he start putting anything through his mouth, then he doesn't do well. That's the only thing I can think of.
And what about his? You said that he had abdominal pain, and can you explain me about abdominal pain in this?
Yeah, he seemed to he just point to his right around his belly button, and he just keep crying, and it's painful for him. And anytime I try to touch, he wouldn't let me.
What type abdominal pain? It's just a simple play or all his abdominal?
He just point out to not a specific location. It's like everything in the stomach.
Does he have anything? Example, is he have fever?
Not too much fever.
Mm-hmm. No. Did you use any medicine for him?
I try to give him some Tylenol for pain, but he also vomited up when he takes it.
Mm-hmm. Now I want to take examination in.
What is your suspicion, doctor? Do you have any idea what this might be?
The first I want do some exam. Can you say me about is he alert or?
He's alert but very agitated. He's usually a very playful child, but now he's just crying, just agitated.
I want to have I have a question. You said that he's crying very loud, and does he crying constantly or just come and go?
It comes and go. Whenever he has the belly pain, that's when he cry a lot. Otherwise, he's just like sleeping or just look very tired.
Mm-hmm. Now I want to know about did he have dehydration?
Dehydration?
Dehydration, yes.
I'm afraid so. His skin looks so dry to me. He hasn't been able to drink water or eat anything for the last few days. So he looked like he lost a couple pounds to me.
Mm-hmm. Now I need to take some tests.
But do you want to examine him first?
Yeah. I want to check his abdominal.
Okay.
Yeah.
Okay, go ahead. You go ahead, doctor. You can examine him.
Did he have abdominal swelling?
A little bit. His belly does look like a little bit swollen to me. It looks a little bit fuller than before.
What the color of the abdominal skin?
The color?
Yes.
It looks a little pink, but I don't see much changes.
Now I want to take some tests. I want to draw a blood test and chest X-ray and abdominal ultrasound to know what happened with him.
Yes, but I would like to know, what do you find on his exam, doctor? What did you find on the guy's exam?
Sorry, could you repeat your question?
Yes. When you exam my son's belly, what did you find? What is your suspicion? If you exam him, did you see anything, and what is your suspicion of why is he having the symptom?
Now, after some exam with your son, I see your son is alert, and he has mild dehydration, and his abdominal is swelling, and he has abdominal pain all the his abdominal, and he has degree of time. And I think he can have intestinal obstruction. And now I need some test to know what it means is exactly.
You mean, what do you mean intestinal obstruction? What do you mean?
Have you heard about intestinal obstruction?
No, my child. I don't know anything about that. Can you tell me?
Do you know about intestine?
Intestine? Yes. Yes, I know about it. So that's where the food go after you eat, right?
Exactly. Yeah. And now your baby intestine is blocked.
But why is it blocking? Is it because he eats something that block it, or why is it blocking?
Now I can say exactly why it's blocked. Because sometimes we have some gas storm, or he has virus acquired die here. It is make intestinal obstruction.
And how do you not like appendicitis or something else, or gallstone or something? How do you know it's an intestinal obstruction?
Well, with the first exam, I can say what exactly, and and if you if I if and then I want to some test, example X-ray or abdominal ultrasound to know what happened with his intestine.
And then what is okay, go. Is that dangerous with X-ray? Is the X-ray okay for a baby?
I think it's okay. It has rarely effect. It's not good for health, but it's rarely, and I I oh, I often take X-ray for my patient.
Okay, what else are you gonna do besides the X-ray and the ultrasound? What other tests are you planning to do? Just the X-ray and the ultrasound?
Yes, I need take another test. Example, blood count and liver and kidney, liver, kidney, and liver and kidney function. And I think it's hard. And yeah, and after that, if your son has intestinal obstruction, I will have treatment for him.
How long is the test gonna take to come back?
I think about 2 hours. 2 hours. We have exam test.
Okay, and how? And you said in 2 hours you will have the result of the test.
Yes.
And then if it's an intestinal obstruction, what option do we have here? How are you gonna treat that?
Okay. Now I said you that your baby has dehydration, and now I will give him intravenous fluid, and if he has partial intestinal obstruction, we can treat with relaxing bowel. And if he has complete obstruction, we need we need surgery. We do have is tool.
Surgery? Did you say surgery?
Yes.
You mean like cut out his bowel? How is he gonna eat? How is he gonna grow if you cut out the bowel?
If you I will open his abdominal, and if his intestine is dead, I need to remove part of his intestine.
And are you gonna replace it with a new intestine, or how is he gonna live? Can you live without the intestine? I thought you need the intestine to live, right?
Can you repeat your question slowly?
If you take out the intestine, how is he gonna get the nutrition? Like if he eat now, where's the nutrition? Where's the food gonna go?
No. I will support his nutrition with intravas to until peri your entire peristalsis good, and he has stool, and I will we will start with liquid food.
Okay. So you said you're gonna start with the IV food and then liquid diet. My other question is my son is too small? Is he okay for have surgery? Can he stand the surgery? What are the risks of the surgery? He's so little. I don't know if he can go to surgery.
It's okay because I'm pediatrician, and I know how to have him pass the surgery.
Okay, and how long after the surgery he was gonna be back to normal?
About I think about 3 days.
3 days. Okay. And one more question. what if it? How do you prevent this from happening again? Like, what if it happened again? How can I prevent this? Some kind of food that I should avoid, or why did this happen, and how do I prevent it from happening again?
Nói lại tất cả. Could you repeat your question?
How do I prevent the obstruction from happening again in the future? We can't have surgery every few months, right? Is there anything I can do to prevent the obstruction from happening again? Do you understand my question, doctor?
Yes, but you can't. I understand your question, but we don't have good present for this disease, and you need take care him good, and you need take him to the doctor when you see a similar symptom. That's all.
Okay. So what's the next step here, doctor? What's the next step? Is the next step, or you gonna watch and wait?
Now I will now I need to I need wait. I will talk. I will talk to you what will I do when I have exactly diagnosis and have full test.
Okay. Are you gonna do anything right now before the test come back to help my son? He looked really skinny and lost a lot of weight.
That I said, I will get intravenous fluid for him.
Okay. I'm sorry. I was so nervous about my son. I forgot that you told me that.
Okay.
Thank you, doctor. Anything else you want to tell me?
No, you. I think you need keep your calm. And I will try to have your son with our I have.
Okay.
Yeah.
Thank you so much. Thank you so much. That's it. Chị Như có comment hay là Sarah? Giờ còn có 3 người mình thôi. Chị Như với lại Sarah có comment gì không ạ?
Yeah. I think that it's a little bit confusing with the history and the diagnosis, and finally I really want to see what the diagnosis, the definitive diagnosis that you have. So I think that the vomiting, nose stool, irritated, equals some obstruction, right? And then because of that, you might need to check also the general status to see how the kid look like for you. Is the kid still alert or look dehydrated? You need to mention the vital signs of the kid. I don't think I hear that. Only the abdomen. Anything else? Heart rate, heart rate, exam, anything else that you check on the kid, or only the abdomen? And if the abdomen, you might need to mention also how you hear the bowel sound, any bowel sound, how you see the abdomen, is it a very distended abdomen? Any other signs that you find on the kid? Do you do any digital exam on the kid also, or you just do regular exam outside? Is the kid passing gas or not passing gas? Any background history of the baby that you should know? Any like heart disease, lung disease, anything that you should know on the kid? Then the test will be focusing on the obstruction, any first and always anemia and regular lab. Electrolyte is really important when you do obstruction kit. Make sure you do mention about electrolyte for the kid, and then ultrasound, X-ray. You mentioned about that. I think that it's better for us to know what the result and how you solve the problem. For example, you say, okay, we like the other cases that the other doctor they tell you, they throw out the result. Okay, your kid has partial obstruction. Your kid has totally complete obstruction. Then your plan will be like this and this. It's clearer, so you can lead the case. And you need to consult any surgeon on this case. The good thing you put IV fluid, yeah, that's very critical, important on this kiddo. And you might need to make sure that the kid is just throw out the diagnosis. I cannot guess on this case what you plan to do on this case. Then from there you talk better about treatment, plan, prevention, recovery. That's what I think. Thank you.
Thank you.
Anything from Sarah?
Yeah, so basically you are a little bit too nervous. So you let Dr. Queen like drive the case, not you. So you need to take charge of the case. We're here to help you, but like during the conversation, we are the parent, you are the doctor, you are the one who have to lead the case, not us. So you have to take charge of it, know what you want to ask, and like let us know the information so we can like act accordingly. Because like if you don't tell us anything, then we cannot like really react correctly. And I do suggest that you work on your pronunciation, because some of the word is very heavy and like it's very difficult for us to like to understand. So if you can like improve that, then your English will be much like better. I think that's it.
Yeah, I think just as some small comment, I don't know if barium, I don't know if you guys use barium to diagnose this. That's not my area. But the other thing is maybe on the exam, maybe I know it's difficult because you're talking to the parent, but at least you can summarize the exam for the family. Say that I did you about the exam. These are the signs that I see that are concerning, and these are the signs that are not concerning. Like I don't see guarding, I don't see rebound. And then why did you do the X-ray? You say I want to do the X-ray to make sure you see the gas pattern or whatever, because the parent was concerned about the side effect. You have to tell them why this benefit to get the X-ray. And then the other thing is that the patient will always ask questions that you're not planned. Like in this case, I was trying to ask you about appendicitis. Maybe you can bring the patient back to the focus by saying, you know, it may or might not be a possibility. Here's the reason why I didn't think it was a possibility. He didn't have fever, or based on my exam, my suspicion on it is low or something, so that you can reassure them and bring them back to your leading diagnosis. As that, you know, at his age group, the leading common cause based on his symptom is this. That's why I'm doing this study to confirm it. The other diagnoses are a possibility, but it is a little bit less likely based on his age, based on my exam, based on the way that he presents. Maybe that will help you take charge more of the conversation and the discussion. I think that's all I have for this case. But good effort. Okay.
Hello.
Hello. Hello, doctor. What are you gonna present today, and who would you like to be your patient?
My topic today is asthma.
What is it?
Asthma.
Asthma. Okay.
And I'd like to talk with Dr. New.
Okay.
Okay. Go ahead. I will try. Whenever my kid call me, I need to go. So just go ahead. I should be fine. So asthma.
Yeah.
Is that right?
Go.
Please continue.
Good morning, madam. I'm your child doctor today, and please tell me what can I do for you? What can I do for you?
My kid is a 2-year-old boy, and I don't know. He's coughing a lot.
Yeah, coughing. Yeah. When it starts?
It's about 3-4 days ago. I start to see him coughing, and I think it's getting worse now.
Getting worse. And how long?
Yes.
How long it lasts? The cough?
He cough more at night, but he also cough in the daytime.
Daytime?
Yes.
It's persistent or spasmodic? It comes and goes or it's continuous?
The cough, it go for a long cough, then he's got a little bit better, but I don't think that he totally fine at that time. He's still a little bit irritated, and he cough again, maybe sometimes in an hour.
Yeah, and dry cough or the cough with sputum?
The first 1 or 2 days it seemed dry, but right now it seems to be wet.
Wet? Okay. And what the color of the sputum?
It's kind of clear. I'm sorry. Clear and a little bit white, I can see.
And how he has any other symptoms besides the cough, fever, or runny nose, blocked nose?
I don't think he has any fever yet. He has a bit slight runny nose and clear runny nose.
You check? Have you checked temperature or not, or you just check his skin?
I just feel him over his head. Yeah. He doesn't feel warm for me.
Yeah. And have you checked the medication yet?
He's not on any medication right now, doctor.
You hear that he's wheezing. You know wheezing?
What is wheezing?
Yeah. And he seems to be this year a sharp breath. short of breath. Difficult to breathe.
Okay. So he has difficult breathing right now?
Yeah.
Okay.
And is he allergy to something such as animal fur or dirt?
We have a cat at home, and he seemed to be sneezing a lot around the cat.
Cat?
Yes.
And are there any member in your family who has problem like him?
Yes, I have another. He has another cousin with the same symptoms as him.
I mean that's his parent, you or your husband or his sibling have asthma and allergy to something.
The sibling has allergy, like a skin allergy, but the sibling has no asthma.
Yeah. And now I will take the temperature for him, the vital sign, and it's examine the lung, the respiratory system, cardiovascular system.
Okay.
And he has fever.
Okay.
He has fever and he has wheezing, cough with sputum, dyspnea, and runny nose. He allergy to the camphor, and I heard that his lung had a inflamed fluid, and so I diagnosed he has asthma.
Okay. What is asthma, doctor?
That's the condition that's swelling the lower airway, and the lower airways will narrow than normal, so it's hard to breathe, and it makes him wheezing and dyspnea, short breath.
Okay.
Yeah.
So does he has wheezing right now? Do you hear him wheezing right now?
Yes. He's wheezing.
Okay. Is there any other sickness that go with the wheezing, or only he has asthma? Because I think it's the first time he has wheezing.
Many conditions has wheezing, but the wheezing as your baby is asthma. So I will take him the medication that make dilate the airway to make him to help him easy to breathe. And I will draw the blood to take the blood count and the chest X-ray to examine his lung to evaluate the condition of the lung.
Okay. So can I bring the kid home after, or I need to admit to the hospital with this?
Yeah, admit to hospital right now because he gets the asthma attack. Maybe if he reduce that symptom, he maybe you can control it at home.
Okay.
Yeah.
So my child in the severe situation right now that need to go to the hospital. Beside the breathing treatment, is anything else that the kid needs?
Yeah, he had fever, and I heard that he had inflamed fluid in his lung. And I will check the blood count, and I will get him antibiotic to treat the pneumonia. Pneumonia is usually a complication of asthma.
Okay. So he has both asthma and pneumonia now, doctor?
Yes, both.
Okay. So he will need the breathing medication and the antibiotics right now?
Yeah.
Okay. And is the x-ray showing that he has a very bad pneumonia?
Sorry?
Does the x-ray show that he has a very bad pneumonia now?
No, not bad. Okay. Yeah, when he has the asthma, maybe his immunity is reduced. It's not better than normal, so it's easy for him to get better. Yeah, so he has fever and inflamed the lung.
Okay, and then when my kid can go home, in what condition you can send my kid home?
So when all of the symptoms. All of his symptoms reduced, such as he has no fever, has no wheezing, and maybe his condition is better. It's not worse, so he can go home and control the asthma at home.
Okay, okay. So thank you, doctor. Is anything else I should know about this?
Yeah, and he is in the asthmatic stage, so you should supplement the vitamin, mineral, nutrition, and avoid many high risk factors such as animal fur, dust, and avoid many strong activity. Have you had many action for me?
Sorry?
Any question for me?
No, for right now, I just wish that you get better, and I can follow up with you later. Thank you, doctor. Thank you very much for your care for my kid. Okay,
thank you.
Thank you. So I think I need to go now. Let me just get you a quick impression. The case is pretty clear. I'm just not know how we jump into the asthma without any other diagnosis yet, like a bronchiolitis. And then for sure that might be the asthma you need to treat a little bit breathing treatment and recheck. So you might need to say that, oh, I will give you a breathing treatment and we'll recheck it to see how your kid respond to the treatment. And if it responds well, likely does have an asthmatic factor in there. Plus CBC, I agree, you can do it. You might need to mention about the oxygen level, any respiratory distress right now on the kid in order to admit the kid to the hospital, because not all the kid will have even asthma and need to admit to the hospital. Chest X-ray, I agree, especially when you feel that they have more than asthma, might be pneumonia, and you confirm that by X-ray. I agree that, and I agree that they need to get antibiotics with the breathing treatment, and avoid activities only when the kid is sick right now. After that, he's getting better, he can go back to regular activity. And you might need to, maybe with asthma, you might need to get the inhaler before activity also, it will be helpful. Avoid cat, yeah, I agree that they need to suggest that also. Yeah, Sinhat.
Okay. Anything, Sarah? Anything before our last? This is our last case, right? Okay.
Yes.
I think so I think I agree with Dr. Yu, because like in a 2 years old kid with first episode of breathing problem jumping right straight to asthma diagnosis is kind of a leap, because in the US you usually don't give the asthma diagnosis to a kid until about 6 years old, because you need a PFT, a pulmonary function test, to confirm it is asthma. Because like sometimes it can just be a reactive airway disease responding to a pneumonia. It 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 looks like an asthma, but it's not causing, like it's not intrinsic to the patient. It's just a response of the body to the pneumonia sometimes too. So I think jumping to asthma is kind of a big jump, but like otherwise it's good. Let's see. Yeah, generally, it's a clear case, good presentation. You mentioned you did some counseling, and so it might be good to have like a quick summaries of the case, like a heads up, like what to do, and like in a few sentences for the mom to easier for mom to remember. Yeah, that's it.
Okay. So maybe just a few small comment from me. So maybe try to explain the wheezing better to the patient, because I feel like I don't know if she understand when you say wheezing. She seems to doesn't understand it. Maybe you explain why is it wheezing. Maybe you can say like because of the, for asthma the airway get narrowing, so the air cannot move out, so it create like a squeaking noise or squeaking sound. Maybe that may make them understand it better. And then the other thing is just for this, maybe explain like what happened what is your initial treatment. You presumably with asthma, so what's your initial treatment? Broncho inhaler, steroid, or whatever. What if it doesn't work? What are the other options? What if it works? And then the last thing is like and maybe Sarah mentioned this before, but maybe just explain to her what are the follow-up after this. So after she recovers from this, how do you definitively diagnose the asthma? When he recover, maybe do a pulmonary function test or something to definitively diagnose that, and then a measure to prevent that. You mentioned avoid certain thing, but maybe an allergy test to specifically know what trigger it, or exercise, or if people, older people, some people have exercise-induced asthma, then maybe how you diagnose that, and maybe give them something to prevent the attack before exercise, like a bronchodilator or something before the exercise. But I think it's a good case, but maybe summarize and explain the next step of treatment and diagnosis for the patient. Maybe they would understand it a little bit better.
Thank you.
Any question or concern for us?
Thank you for your...
Okay. I think you might be the last person. I don't know if Dr. Huân is back. I saw him eating earlier, but I don't know where he is now. So I think next week is Thanksgiving here, so I don't think we have a lecture, but I think it's going to be in 2 weeks. Is the next lecture. So if that's okay, I don't know if Dr. Huân has a plan for the last lecture about discussion the good and the bad point of the class and how to improve. But if you guys have any other suggestions.
Another group of exam. Like this is only half of the group. We still have.
Okay. So the next week, the last half, and then we can discuss how we can improve this class and for the next group. Okay. Okay. I will see you guys in 2 weeks. Huh? Bye bye. Thank you.
Happy Thanksgiving days.
Thank you. Bye bye.
Mọi người giờ mọi người tính sao? Đi chơi sao?
Nó phải
tiền khổ sở, ví dụ đi chơi trời không bao nhiêu tình cảm, tất cả là chỉ cười tốt thôi, con ngay là họ từ đủ chỉ biết một con chó vậy. Biết chứ, đây là bao nhiêu này, đó là bao nhiêu cái ly trong cái tay người chỉ đi. Vậy đi thứ bảy thì nó dễ chịu hơn, rồi thứ bảy thì
mình chơi rồi, mình có ở lại không chị?
Nó trở lại thì ở lại, ai có tất cả Sân khổ rồi đó, sân khổ này nữa thì mọi người sẽ bắt đầu ra từ tay về chiều lên tới sáng hôm sau. Thì những người mà đi làm ngày á, thì 5 giờ là trời tới.
Dương như rừng con.
Salad thì salad, mình sẽ biết là gì. Còn hay là đi xe buýt thì tiện hơn.
Mình chỉ còn thuế sáng đó. Xe đạp thôi. Đi xe buýt xe đạp. Nếu mà ăn thì
Đi chơi sáng thứ bảy, từ sáng thứ bảy cay trưa rồi mình ăn tới ăn trưa ăn đồ lại hôm nay
đi
đổ rồi chơi có bộ rồi nữa chứ còn đi đổ theo ca mình tính bao nhiêu người không đi được.
Những có đi đâu thì nó
lực con nó là gái được không?
Chị đổ anh tiền vào đó là sáng này nó là tiền không chị
cái gì bây giờ
em là nói thứ sáu
em nói thứ sáu à?
Chị sáng thứ bảy chị đổ anh tiền vào có ai đổ cũng là được chứ.
Em trực tội cho nhà.
Em đổ ra em đổ ra có thể đổ được không? Mình cứ đi từ buổi sáng nó chạy tay ra cho tới
nó cầm cả cái sức nơi đây nhá.
Được bệnh
Phương Thảo nó đứng ngay thì phải.
không Thảo có thể đổ được mà nó mà có thể đổ mà
đi chụp lại
này đi chụp mày nó
không Thảo là đi chụp ảnh cưới thì
là sự căm năm của hai
chúng tôi thích tự Thảo làm rồi
Tháo tiền rồi đó Tháo tiền rồi
rồi em mắng đi đó hai em gái thì
Tháo rồi là lắp lại Tháo là để lắp lại Tháo là chụp
cười cái đà không cười Thảo những cái mà cười xong rồi
Cưới đến tháng 12 luôn mà.
cái chủ yếu là cười thôi chứ con chụp thì có không có sốc nói
Không có tao nãy cái hòm hàm lấy mà
lâu kêu mời gì mời gần đây bị dính keo á cái đầu trà giống như là già
như là lý mình con đấy
hồi trước em làm á
mình con kể những cái quý kéo bên cạnh
em phải đi cho ta
kết
rồi chứ
rồi đi làm cái hộp này
mà cái
đi ở dưới nhà dưới điện thoại
đi cái cho nhánh này
vì là không biết là có đi được không